Medically compromised patients are my primary focus as part of my PhD and beyond. So we did develop approaches in regards to prevention of medication-induced osteonecrosis, and recently I've been looking more at the prevalence of oral cancer, among other things. I'm Professor Dileep Sharma. I'm the head of oral health at the University of Newcastle. I come from a perio background. I've done my dentistry from India, completed my master's in periodontics, and then moved to different parts of the world teaching dentistry. So when I reached Australia, I came in as a PhD student, working mainly on my passion, which is the priority population research. So my focus was on medication-induced osteonecrosis of the jaw, where I worked on developing models and treatment approaches for prevention of medication-induced osteonecrosis. Few years into my career, I moved into James Cook University as a senior lecturer in periodontics and a discipline lead, where I developed the program and taught into it for about six and a half years. Subsequently, I moved here to take up the leadership role in oral health, where I lead the program of Bachelor of Oral Health Therapy at University of Newcastle. My research is focused on improving access to dental care in priority population, be it medically compromised patients, be it dementia, mental health, and particularly aged care sector. My research is, as I mentioned, the priority population and in improving access to dental care. So medically compromised patients are my primary focus as part of my PhD and beyond. So we did develop approaches in regards to prevention of medication-induced osteonecrosis, and recently I've been looking more at the prevalence of oral cancer, among other things. So Australia is as you know, capital of different kinds of cancers. So oral cancer is one of the most neglected one of those, because there is really no formal screening happening on a routine basis. So our research, particularly focusing on Queensland population, found that there is an increasing trend of oral cancers currently in Australia, specifically based on Queensland data. I have a range of collaborators, both we call category 1 collaborators, as in research organizations. I collaborate with HMRI, which is the Hunter Medical Research Institute based at University of Newcastle, but also multiple organizations like Australian Dental Research Foundation and Tropical Academy of Tropical Health. IADR, the International Association of Dental Research, is one of the principal funders of the projects that we are currently undertaking, and focused on priority population, that is dementia and mental health. The other funding organizations include Central Coast, LHD, and I have funding from Dental Council of New South Wales. I really love what I do, because I have the luxury of answering the questions through my research. I have been a researcher from the beginning, so during my master's as well, my focus was on pathogenesis of periodontal diseases and pathogenesis of bisphosphonate-induced osteonecrosis. So it was natural for me to pick that up as my future direction, and I did a fair bit of cell culture work and also PCR and molecular biology work in that space. That project actually confirmed the role of angiogenesis or lack of angiogenesis as a pathogenesis in bisphosphonate-induced osteonecrosis. I like to spend time with my family and travel. That's my passion. Often with my role, it becomes a bit more challenging to travel off late. But yeah, I like to meet people and interact in a personal but also in professional space.